Thank you so much for being here today. I want to give Oklahomans an update on our COVID-19 response and how the state and the medical community are working together. Today we're at OU Health in Oklahoma City, and I want to thank CEO Chuck Spicer and his team for hosting us here today. What a beautiful new facility, and hopefully we'll take a tour of this here in a minute. We're also joined by chief medical officers and doctors from hospitals in the Oklahoma City Metro. I want to introduce Dr. Cameron Mantor, the Chief Medical Officer for OU Health Hospital. Dr. Linda Salinas, COVID-19 Medical Branch Director of OU Health. Dr. Julie Watson, Vice President of Medical Affairs for Integris and the Chief Medical Officer of Integris Baptist. And Dr. David Chansom, Integris Medical Director of Infectious Prevention. You'll hear from all of them in just a minute. We're also joined by Dr. Noel Williams, Coordinator of the Central Oklahoma Inter-Hospital COVID Task Force. Dr. Kersey Winfrey, Chief Medical Officer for SSM Health. Dr. Chad Smith, Vice President of Mercy Health. Dr. Jeff Cruzon, President of Integris Medical Group, and Dr. Carl Ruskowski, President of Integris Health Partners. Welcome, and thank you all for your leadership for Oklahoma. I want to thank all the doctors here for their partnership and the guidance as we work together to fight this virus. My administration has been working closely with this group, and it's important to be hearing from boots on the ground. To all the doctors, the nurses, the therapists, the healthcare professionals across the state, I want to personally tell you thank you. Thank you for all your hard work in taking care of Oklahomans. I know it's tough right now. I know that you're working long hours. You feel the weight both physically and emotionally. And on behalf of Oklahomans, I want to thank you for all your hard work. We are so grateful for you, and we are going to get through this together. And now I'll ask Dr. Lance Fry, our Commissioner of Health, to give us a situation update. Dr. Fry.
Governor. I'm happy to be here today with these physicians and hospitals that have been working with us throughout this response towards the pandemic. These men and women have been working tirelessly since the beginning of this pandemic. I'm very proud to be working with them as partners in continued treatment of COVID patients and management of our hospital capacity. We want to assure the public the state is working in partnership with hospital and medical professionals on a continued, patient-focused and coordinated COVID-19 response. 8 months into this pandemic, and we know COVID-19 has been challenging for our people, our medical professionals, and our state. I wake up every morning thinking about how to keep Oklahomans safe, and this is why all of us are here today. But we have to remember, COVID-19 is a highly contagious virus that's spreading throughout our state. The trends we're seeing are concerning. We all must take this virus seriously and continue to take aggressive actions to slow the spread of transmission. It's going to take every Oklahoman working together to do the right thing to get us through this. We can each personally contribute to slowing community spread and keeping our fellow Oklahomans safe by choosing to avoid large gatherings, wearing a mask, washing our hands, and watching our distance. I wear a mask every day, and I ask every Oklahoman to wear a mask as well. We urge all Oklahomans to do their part. The holidays are coming, and we know people will want to celebrate with their friends and family. Remember, you can spread the virus to someone even though you don't have symptoms. It's a natural reaction to let our guard down when we're around our families, but as we enter the holiday season with our family, friends, and neighbors, please be careful. Many people who get this virus will have mild symptoms, but the doctors here with us today can tell you that some people have very severe cases. This can happen even in younger people that would be otherwise considered healthy. Hospital capacity is always a concern and something we are monitoring daily. We are aware of the impact currently going on in Tulsa and are working with local leaders and hospital coalitions in both metro areas to ensure every Oklahoman who needs a hospital will have a bed. We have put in the work this year, but we're going to need to continue to finish doing this throughout the rest of the year with more work to get through this. Dr. Chansom will be elaborating in a few minutes on the vaccine, but we know a vaccine is coming, and with availability probably by early December, we're going to start having that available for our most vulnerable population and our healthcare workers. It's exciting to know a vaccine's on the way, but it's not an immediate fix. Right now, we are again asking all Oklahomans to do the right thing, to do their part, and to wear a mask, wash your hands, and watch your distance. Governor Stitt.
Thank you, Dr. Fry. I know you've been hearing a lot about our hospital system, and I know some of you are worried about that, but I want Oklahomans to know how strongly our medical community is working together against COVID-19. Hospitals are sharing information and strategies to make sure all Oklahomans get the care that they need, regardless of which hospital they go to. I want to invite Dr. Cameron Manter, Chief Medical Officer at OU Health, to tell us more about that.
Thank you, Governor Stitt, and I would like to thank you for allowing us to participate in today's press conference here at OU Health. As you said, I'm Cameron Manter. I'm the Chief Medical Officer for OU Health. But I want to make sure that it is very clear to everybody that's here today that I'm speaking on behalf of, and when I say we, I'm referring to all of the CMOs in our region. Since March of this year, we've been having regular meetings in an attempt to understand what has COVID-19 done to our country and to our state. Noel Williams has been instrumental in getting our CMO task force together, with Kersey Winfrey from St. Anthony's, Chad Smith from Mercy, Aaron Boyd from Norman, Julie Watson from Integris. We are all trying to assist both our healthcare systems and all Oklahomans in determining the best way to combat this disease. If we look back to March of this year, we had minimal testing, we were uncertain about sources of PPE, and a frightful understanding of what COVID was doing in New York City. So we shut down a lot of our elective procedures with anticipation of a surge in patients. Well, that surge didn't happen. So over the summer months, we were able to open our businesses back up and our hospitals returned to relatively normal operations. Now let's fast forward to October, November. Our region is now in Tier 3. That means on average, the hospitals have 20% of their patient beds filled with patients positive for COVID. In the summer months, we saw a fairly large increase in positives in teenagers and young adults, particularly women. These numbers have significantly decreased through October, with a proportionate increase in those 60 years of age and older. Of note, this particular virus does not seem to be as severely affecting our young infants, which normally tend to have worsening outcomes with infections. The past week, our daily rolling average in Oklahoma showed 1,730 new cases, compared to 1,000 just 1 month ago. This past week, our daily rolling average of deaths is 14 versus 7 1 month ago. Lastly, over the past 10 days, our number of active cases in Oklahoma has risen from 15,000 to 20,000. These are significant increases which affect both our communities as well as our healthcare systems and our healthcare workers. So you might ask, well, if our beds are 20% COVID positive patients, don't we have 75 to 80% of the remaining beds that we can use to care for other patients with this virus? But let's not forget, there are many other Oklahomans who need medical care, newly diagnosed cancers, patients with heart disease and other chronic diseases, level 1 trauma. As the state's only level 1 trauma center, we have to make sure that we're able to care for trauma patients as well as these other patients who need our care. So this is really where our collaboration has come into play. So as medical leaders that you see here for our community, we're all trying to come up with the most efficient and the most effective way that we can combat this virus. You're going to hear from Dr. Salinas and Dr. Chansom in a few minutes. We're creating new beds, such as the bed tower behind us. With the state's help, we were able to open one floor early, have the second floor open, and later this spring and early summer we'll open two more floors. Beds, however, are not enough. Staffing is becoming an issue. Nursing, respiratory therapy, physicians. Hospitals in the region are actively looking at nursing ratios together and ensuring patient transfers occur with these coordinated numbers in mind. We brought in travelers, locums physicians, and are creating care teams to help us care for more patients than we've been able to in the past. But these physical and manpower resources do have a limit. If our current rate of infection is not curbed, we will run out of beds and of staff. Not all patients can be cared for in all facilities. So we would like to develop a state distribution center who can assist us in determining the capacity and the capability of all of the hospitals in the state. This will allow us to effectively manage more patients finding the right care in the right facility. It's just as important for one of our smaller community hospitals who can care for less acutely ill patients be able to do so in order that our advanced hospitals with quaternary care, high-level ICUs, ECMO care, can provide the care for our most ill Oklahomans. Should we think about restricting or stopping surgical cases as we did in the spring? Well, in doing so, we were very successful in creating a plethora of beds. However, we have since learned that this came at a cost to the health of many Oklahomans. As I've stated, we still have an obligation to care for all of those who need our medical care, whether they be COVID-related or not. We are all actively looking at plans on how we will manage elective surgical procedures should our COVID admissions continue with their upward trend. So this is normally when I get on my soapbox and I would start talking about the community, how they need to do their part. I'm going to let this to Dr. Watson in a little bit. I will simply state that the hospitals and the physicians cannot stop this pandemic. This virus is being spread in our communities, which means that it's up to you and to me and to all Oklahomans that we all need to take responsibility for stopping the spread of this disease. I would like to introduce Dr. Linda Salinas, who is the OU Health epidemiologist and an infectious disease physician.
Thank you, Dr. Mantor, and good afternoon to all of you. We've seen an evolution in the treatment of COVID-19 over the last 9 months, from the early days and the use of lopinavir/ritonavir to our current management. Treatment protocols are developed based on science and clinical trials, and these are developed by multidisciplinary teams. Currently, remdesivir is approved by the FDA and is most effective early in the disease course. Dexamethasone, which is a steroid, is given for about 10 days for those patients requiring supplemental oxygen. Convalescent plasma, which is collected from previously positive patients, is also a treatment option. But what I'm excited to tell you about is a new product called Bamlinivumab. I was up most of last night trying to learn how to pronounce this. It was granted emergency use authorization last night, and I think something that speaks to how things change and how rapidly things change. When I started writing my speaker's notes yesterday afternoon, it had not had emergency use authorization. By the time I finished them, it did. So what is it? It is a monoclonal antibody, which is a neutralizing antibody, and it's designed to block viral attachment and entry into the human cells. It is given as a single intravenous infusion, and it's to be used for non-hospitalized, so outpatients, within about 10 days of the onset of symptoms. It's targeted to very specific populations, to include those 65 and over, and those 12 and older with comorbidities. In clinical trials, it was shown to decrease the hospitalization rate for those that received it. There is an allocation program very similar to what we saw with remdesivir early on. And true to OU Health, we have already started the process of planning, of setup and administration, and how to get this to our patients as soon as it's made available to us. Just as Dr. Mantor noted the collaboration among the chief medical officers, so have we infectious diseases physicians and hospital epidemiologists. In early March, Drs. John Hartkus of Mercy, Dr. Jim Kirk of SSM, and Dr. David Chansom of Integris, who you'll be hearing from in just a minute, got together right here at OU to begin our discussions. We could not have anticipated the magnitude nor the complexity of this pandemic, but we knew that this was something that none of us, even with our collective 100 years of experience, could begin to tackle alone. We have kept in constant contact to discuss things like clinical trial results, to formulate policies. We have collaborated and aligned with the goal of keeping our healthcare workers safe and providing the best care to Oklahomans. Thank you.
Thank you, Dr. Mantor and Dr. Salinas. When we met with the medical community, they asked for help in a couple ways. One was to reactivate a system called the Regional Medical Response System, or RMRS. This system is used in tornadoes or large disaster. It's designed to transfer patients between hospitals. This makes sure Oklahomans are connected to a hospital bed as quickly as possible. The hospitals asked for help with more nurses. We've instructed the nursing board to clear any red tape, to allow nursing students and nurses who are licensed in other states to practice in the state of Oklahoma. We're also recommending all college students get COVID testing before they return home for the holidays and leave campus for Thanksgiving. We've already discussed with OU and OSU, and university presidents have committed to providing free testing for students before they head home. I encourage leaders from all the colleges and universities to connect with the health department if they need help in any way. Getting a test before you head home will make sure you do not bring this virus back home to your loved ones. Parents, I know you're excited to get your kids home for Thanksgiving. I'm excited to get my daughter home as well. But please help us encourage your kids to get a negative test before they leave campus. They can always call 211 anywhere in Oklahoma, and it'll let them know where some of the 80 sites are set up where they can get a test. The other thing that doctors ask is for an increase, to increase our education on how we can slow the spread of this virus. We know the 3 W's are the most effective way to slow the spread: to wash your hands, to watch your distance, and to wear a mask. You've heard me say this for months, but we cannot become complacent. I know it's hard to keep this up over long periods of time. Oklahomans did such a great job early on in the spring to flatten the curve. But if you've taken your foot off the gas, I'm asking you to tighten things up. Keep doing your part. We need it more than ever right now. I toured a COVID ward again the other day and spent some time with people who work in the ICU, taking care of the sickest people in Oklahoma. And I'll tell you, those folks are tired. They've been working long hours in really tough conditions for months. They need our help right now more than ever. When this pandemic started, people everywhere went out of their way to support our healthcare workers. Remember all the healthcare hero signs that we saw? Well, the best way to support them now is to help them slow the spread. Now I'd like to turn it over to Dr. Julie Watson, the Chief Medical Officer at Integris. Dr. Watson?
Good afternoon. I'm Dr. Julie Watson, the Chief Medical Officer for Integris Health. Thank you for joining us today, and thank you to our OU Health colleagues and Governor Stitt for hosting this important press conference. As the number of coronavirus cases continues to rise across the state, physician leaders have gathered together to make a public plea. We stand here today as a unified medical community, asking all of you watching, all of Oklahoma, to do their part to slow and end this devastating pandemic. The medical community is united today, and we are asking for your participation because the science is clear. Wearing a mask, along with other preventive measures, such as keeping a safe distance and washing your hands, has been proven to slow the spread of COVID-19 in our communities. In fact, since August 1st, cities whose residents are wearing masks saw a 21% rise in cases, compared to an 88% increase in cities where residents aren't wearing masks. I grew up outside of Chakota, Oklahoma. I'm grateful to Carrie Underwood for putting our hometown on the map, but Chakota was town for our family. I was raised on a farm and could not be more grateful for my upbringing and for what it taught me about contribution. Where I grew up, contributing was just a part of life. It was expected that my sister and I work hard and that we contribute to our family's farm, to our church family, or to a neighbor who needed a hand. And that's really what I would like to talk to you about today: contribution and participation. The science is real and the numbers are real. Wearing a mask saves lives. Many Oklahomans and Americans have wondered if this is just political maneuvering and if the science was being manipulated. I can tell you it isn't. Many Oklahomans have felt that way. We now know that 40 to 50% of us may not show signs of this illness, but can yet still spread it to those of us who will. I tell you this as a doctor who dedicated her life and career to taking care of some of the most vulnerable patients, babies in the intensive care unit. I stand here today representing doctors who have dedicated their lives to studying medicine and science to be there for you when you need us, which is an honor and a privilege. You come to us to care for you in your If you trust us to take care of you when you come to us with cancer or heart disease or a car accident, please trust us now when we tell you wearing a mask makes a difference. Wearing a mask is not a sign of weakness or fear. It is not a political statement. It's an outward symbol that says, I am contributing. I am willing to do what it takes to help. And it's also not about a mandate. The governor nor the government should have to tell us to do the right thing. We know better now, so we need to do better. A mask is not political. This is not about anything else. This is about each and every one of us participating in a collective cause. We pride ourselves in helping each other during times of trouble. That's the Oklahoma standard. Whether it's after an explosion or a tornado or during a global pandemic. Oklahomans help Oklahomans. And right now, that means wearing a mask. I tell you this in all sincerity, Oklahoma. We are in trouble. Our local and state healthcare resources are approaching their limits, And if nothing is done soon to slow the rise in cases, our hospitals will be more overwhelmed than they already are, and we won't be able to be there for all of those who need it. Our worst nightmare right now for any one of us physicians or healthcare workers is having to choose between a patient in a car accident and a patient with COVID, an early cancer diagnosis and COVID, surgery for a patient who needs it, and COVID. Every single Oklahoman is important. We can make a difference and preserve resources for all patients by simply wearing a mask. We must prevent the preventable. We know better now. We must do better. I know we are all tired. We are tired of COVID, and we want our lives back. This won't last forever, and a vaccine is on the horizon. Until then, the relatively simple act of wearing a mask can help us preserve not only our precious healthcare resources, but also the things that bring us joy. Getting together with our family, seeing friends, going to our places of worship, keeping our children in schools. Keep this in mind. Maybe the person next to you at the gas station or in the grocery store is a healthcare worker, or a teacher, or a patient who started chemotherapy. Wear your mask for them. We are all in this together. The medical community, our state agencies, the governor, college students who may be vulnerable themselves and are returning home to vulnerable family members, neighbors, church and faith families, patrons and business owners. We are all in this together, and we must all do our part. Our stark reality is that we have a moment to impact this now by making a choice. Before we have to resort to extreme measures, let's choose as citizens, as Oklahomans who care about each other, to contribute, to participate. Wear your mask for all of us. It can make all the difference.
Thank you, Dr. Watson. As Dr. Watson mentioned, now is the time. We need all Oklahomans to step up and do the right thing. Help us protect your families, neighbors, and those who are the most vulnerable. This won't last forever. In Oklahoma, we're going to get through this, but we have to do it together. We need to do our part until a vaccine is here. The good news is that day is coming really, really soon. And I want to turn it over to Dr. Chansom for the latest on progress with vaccines. Dr. Chansom.
Thank you, Governor Stitt, and thank you, Dr. Mantor and Chuck and the other physicians here at OU and the OU community for having us today. It's a gorgeous facility, and as a grad of OU, it makes me very proud to see it. It's beautiful. So, I'm sure many of you have heard by now, Pfizer announced, well, it says yesterday here, but it's actually about 2 days ago, some very promising news on the COVID-19 vaccine they are currently working on. The most recent data from the ongoing Stage 3 clinical trial shows the company's vaccine is more effective at preventing COVID-19 than the placebo. Several other vaccines are also in late-stage testing and may be available soon. The Pfizer vaccine they called 90% effective. I haven't seen the specific data. I know as much as everybody else does. But they had over 44,000 trial participants in that. It was a very robust study, and the news has been very, very good. Of course, more data is needed before the vaccine can be approved by the FDA, but this is a definite step in the right direction. If all goes as planned, emergency use authorization for high-risk individuals could occur very soon. So what does that mean for Oklahomans? The state has a thoughtful and well-organized plan in place that they have been working on for several months to give the vaccine to Oklahomans in a cascading fashion to address immunity and protection for our highest risk and most vulnerable populations first. With a limited supply of the vaccine, at least initially, distribution will need to be coordinated between each vaccinating location and the state and local health departments, as well as the CDC. I am pleased Integris Health, as well as the other health partners here, have been working with the state and local departments to be a hub for vaccine distribution in our communities all around the state. We are expecting the first vaccine to be available within a month. We have been preparing for this for 6 months, and there are many details to work through, and certainly many more that we haven't thought of. But the state and local health departments are committed to working with community partners like Integris to get the vaccine to those most at risk first. As more vaccine becomes available, and many other community partners like retail pharmacies and doctors' offices, they'll also be able to participate in the effort. I think we can make this happen, but it will be a public health effort unlike anything we have seen before. Other than wearing masks and social distancing, we don't have a lot of tools to prevent COVID-19 infection. A vaccine is our best chance to get control of this virus. As we move into the winter months, we will continue to see a growing number of flu cases. And while we don't yet have a COVID-19 vaccine available, we do have a flu vaccine. And I urge all Oklahomans to receive a flu shot. This simple measure will help reduce the number of flu cases and flu-related hospitalizations, which in turn will take pressure off of our healthcare systems to be able to deliver care to all of our patients. It is a critical help for our hospitals who are already beginning to be overwhelmed. So the COVID-19 vaccine may not yet be available, but the flu vaccine is. Please get yours today. Thank you.
Thank you, Dr. Chansson. As you've heard today, the state is working with our medical community to fight this virus together. I want everyone to know if you or your loved ones get sick, we have the capacity to take care of them. That's true if they have COVID or anything else. We've activated the regional medical response system. We've cleared red tape to help get more nurses. We're encouraging college students to get tested before heading home. And we're reminding Oklahomans how important it is that we all do our part to protect our loved ones, especially those who are the most vulnerable. Remember, if we need more hospital space, we can always pause elective surgeries in any region. We haven't needed to do that here in Oklahoma City because of the great teamwork from our hospital association and our medical professionals. I'm ready to issue an executive order anytime Dr. Fry tells me we need more space. Our goal is to continue to work together with our medical community on the best ways to keep Oklahomans safe and healthy, and I know Oklahomans will work together with all of us as well. We'll open it up for a few questions. Okay.
Sorry, too many shadows. We're in your face.
Ready? Head, watch your head.
Got the regional medical response, who's on that? Dr. Fry?
So the RMRS system was brought on very early in the pandemic response. It was a part of our first surge plan. And it was basically there to kind of work as a air traffic control type of situation to help direct patient transfers. So they will be getting reports on hospitalization and availability of different beds throughout the regions. There's a system in each one of our regions, and they're going to be communicating with each other, both with the hospitals in the regions, but also between the different RMS directors. And basically, they're going to help facilitate the transfer of patients to where there are appropriate beds available. We don't know yet. We haven't signed a contract with anyone. They are producing vaccine while they're still going through the trial. So it's the first time that I'm aware of that this has ever happened. They're doing that so that as soon as they get approval, then they'll have vaccine there to go ahead and immediately distribute. There has been some discussion about potentially pre-distributing vaccines around. That has not happened, but we expect it to come out as soon as it gets approval. And we don't know the amount yet. We've been told anywhere from 2,000 to 20,000, and then we were told 40,000. So we're not really sure the exact amount we're going to get. We know in the first phase it's going to be very limited, and then they'll send more as it's available.
I'd like to follow up on the question from yesterday on hospitals that on their own basis have begun suspending or limiting some elective procedures. Do you know how many facilities or how many hospitals are doing this? I know we spoke generally yesterday, but can you get more specific about where you're seeing that?
Yeah, I don't know how many specifically are doing that. There was a report earlier today from one of the hospitals that had initiated that, and I know that this group of physicians that you see here, the CMOs, have also started talking about using the model that's out of Chicago for how to triage different surgeries to figure out which ones are necessary during a pandemic response and which ones can wait.
So the question was whether Integris Health specifically is looking at suspending elective procedures to some extent. So I will tell you, this is exactly what we are trying to avoid. This is our worst nightmare. When you use the word elective, it's actually something that makes every single physician's blood pressure go sky high. We don't do elective surgeries, to be honest with you. We do medically necessary, time-sensitive surgeries. So can some surgeries be delayed a week, 4 weeks, and not have much impact on the patient condition? Yes, there are a small percentage of procedures. So what we as the CMO team and then internally in all of our facilities do is look at the types of cases that are being performed, and really you hone in on the ones that are actually requiring a hospital bed after the procedure. So to cut all elective surgeries doesn't necessarily get the juice that you're trying to squeeze. So we at Integris Health look at all of our procedures, and we have actually tried to do creative things by extending our surgical week so that we spread things out, so that we can have predictable admissions and discharges. We truly do not want to be forced to choose between COVID, non-COVID. Patients who come to us with heart disease are as important as patients who come to us with COVID. But again, wearing your mask can prevent the spread of COVID. Wearing your mask can't prevent heart disease. So that's why we're really focused on asking Oklahomans to do their part by wearing their masks so that your medical professionals and our health systems aren't having to try to create space by extreme measures. Does that help?
Just a concrete yes or no. Is happening on any extent? I understand it's a very complicated process to say elective is a very overbroad term, but
Yes.
is that happening on any extent right now where you're having to postpone surgeries or procedures for COVID?
We are absolutely looking into that, and it is unfortunately not as simple as a switch that you flip. You have to do the right thing for patients. Yes, sir.
Yeah, well, we've obviously a lot of this press conference is about doing the right thing, and so we've said 100 times up here, wear your mask, watch your distance, make sure we are we're separating, we're washing our hands, and but as far as a mandate, I've been very clear that I don't think that's the right thing to do. This is a personal responsibility. This is pleading with people to do the right thing. And when you look at other states that have done things different than we have in Oklahoma, Illinois, for example, you can't eat in a restaurant inside. Oklahoma's been fully reopened for the past 6 months. They have mask mandates. None of the restaurants are open for in-dining. They're limited all across the board, and yet their cases are higher per capita than Oklahomans. So at the end of the day, it's not about a mandate, it's about doing the right thing. That's why we're here letting Oklahomans know we really need their help to slow this spread, just like we did in the spring. I told everybody in the spring that if we do a great job of innovating, of watching our distance, of letting folks work from home, the quicker we'll get our economy back going and we can lift some of these things. So that's our plea to Oklahomans, and I hope it's not politicized, because we're up here, we're talking about it 100 times, and I think Oklahomans are going to do the right thing. And so we're watching these things very closely. Our hospital community is super engaged in making sure that we have the capacity, the nurses, the hospital beds to take care of our most vulnerable, and that's what we're focused on. But we need everybody's help to continue to slow this spread. Yes, sir.
Tonight, your hometown and Jinx will be voting on a mask mandate. What do you say to them as the most powerful resident they have been?
Well, I'm an Oklahoma City resident now, but I get your point. Here's the deal. We've left that up to the local communities. Again, there's counties that have one case or two cases, and I don't believe in a one-size-fits-all approach. We have to wear a mask, watch a distance, and wash our hands. And when a local community is voting on something, then I'm going to support them. We believe in local control, and so if Jinx does that, that's fantastic. So we're in constant contact with the medical professionals, and Dr. Fry gives me recommendations on what we want to do. But there's more things to think about than there's obviously the livelihoods of those people that you're pulling away from them. So we have to balance all of that. And so really it's a personal responsibility, and I want people to limit those gatherings, to continue to be very, very cautious over the next month. We need to really flatten this curve, and that's kind of why we're here pleading with Oklahomans to do that. But we'll watch the data. Again, we've been fully reopened for 6 months. We think it's important that our kids are in school, and I think 99% of our school districts are open in some format, and that's a good thing. But we have to watch these numbers, and we're seeing some capacity issues, and we're watching that closely in our hospitals.
On March 24th, you issued your safer at home order. Obviously, the situation then and the situation now is different, but all of the statistics compared to then, have gotten much worse. Why was that type of action needed then, but not now?
Well, the safer at home was for our most vulnerable, and that was also the epidemiologists were predicting about 5,000 people in the hospital in early April. And like we said, when we pulled the lever to limit elective surgeries early on, I think Dr. Chanson mentioned that, we had 600 health professionals laid off in Tulsa. We had 1,000 health professionals laid off in Oklahoma City. So we can pull that lever when we want. We can limit elective surgeries, but there's other health complications along with that. And I think Dr. Watson mentioned that elective surgery it's only elective to it's not happening to, right? So there's other consequences. There's early diagnosis for cancer. There's things that don't get discovered in a timely manner when you limit elective surgeries. And so we want to be very, very cautious with those extreme measures. And but we're looking at it, and really that's why we're here in front of Oklahomans right now as a joint effort with the medical community, letting folks know. I think we've kind of taken our foot off the gas a little bit, and I'm encouraging Oklahomans to really take this seriously at this point. I need their help to really slow the spread. We've been, again, fully reopened with no restrictions. We need to dial that back a little bit in personal responsibility to really help us slow this spread. And that's my plea to Oklahomans from the panhandle of Oklahoma to southeast Oklahoma, southwest Oklahoma, the metros, Tulsa and Oklahoma City. And we can do it. We can do it together. The vaccination is, we're getting some traction there. Pfizer said it's 90% effective, and so we're excited about some of those things coming in. We got a great plan to get that out to Oklahomans, and I believe Oklahomans are going to do the right thing. Yeah, so I issued an executive order allowing open meetings to happen virtually early on in March. And so we wanted that to happen. The legislature came in and agreed with this, but it was stopped on November 15th. Nobody anticipated, I think, us needing it past November 15th at that point, so the legislature changed the law. And so between November 15th and February 1st, when the legislature comes back into session, we'll maybe have to have regular meetings. There's probably other ways that they can do it, but there's not a likelihood for the legislature to come back into special session between now and February 1st just for one month of meetings. It doesn't bother me, no. I told him, I said, anything, that doesn't bother me. We can get on the phone, we can make other arrangements. We don't want to put anybody in danger by getting back together. But we also, open meetings is something that the public and the press want to have access, and that's why we have open meetings in the first place. If the legislature wants to change that on February 1st when they come back into session, and I'm sure most of the legislature is talking about changing that with Zoom meetings, et cetera. We're seeing a new way to gather remotely and do it safely, and we really haven't. We've actually seen more participation with those open meetings than in-person meetings, because some citizens are able to dial in and able to voice their opinions or ask questions virtually way more than they were when they had to drive to a state agency building. So we'll get it fixed.
That's a great question. The crystal ball is fairly dark right now. What I can tell you is that all of the hospitals in our community, we're managing this on an hour-to-hour basis. Patients get admitted and discharged routinely. There are times at which OU is on divert. There are times at which Integris is on divert. We all have moments in time when we can't accept another patient, but 2 hours later, that story might be completely different. And so there's no way to predict a time or a day or a number at which we will say there will not be a bed for someone. I think we all realize the curve is not going in the right direction, and it is substantially increasing. And that to us is very scary, that at some point we may get to that. We're not there. We're continuing to manage it on an hour-to-hour basis. I will tell you, speaking personally, I agree with everything that the physicians group has said. I think that I know that wearing a mask and social distancing prevents the spread of respiratory viruses. Coronavirus is a respiratory virus. I think that, as you heard, it's all of our duty to do that. We should do it because it's the right thing to do.
Thanks, everybody.
Thank you. I didn't hear your whole question, but it's something about money running out from the CARES Act on testing, related to testing. Yeah. So we're working with the insurance companies and obviously the Trump administration. I know that our federal delegation was working on another coronavirus relief package, and so yes, the third package ends on December 31st. We all knew that. Congress knows that. Insurance companies are working to see what the testing looks like on January 1st. We should have enough funds to get us through December 31st. That was kind of our plan. And then we'll see what happens next year. And the legislature may have to appropriate money for that. And those are all things that we'll work with the legislature to do.